Good morning, everyone. So, I got this wild idea this morning that I would post a picture of our supplement baskets on Instagram and Facebook. And of course, then everybody wants to know what we're giving our dogs. So, I thought that I would go through the baskets and show you everything that they're getting. And there's actually one missing because I ran out and I'm waiting for Gwen to deliver it to me. And Somebody posted, why don't I just feed them a diet of raw meat and vegetables instead of having to give them all this stuff? And it's like, okay, you don't know whose page you're on. Because our guys are fed raw food, sometimes home cooked, but mostly raw. And they eat a lot of All Provide. Lately, they've been eating some Vital Essentials freeze dried. They get Dr. Harvey's Paradigm or Raw Vibrance with our own raw meats added. So it varies. It kind of depends. Shayna, our oldest, who's 15, starting to get a little picky about what goes in her bowl. She only has 4 teeth. Her tongue doesn't work that well, and she struggles to get the food in her mouth. I actually have to feed her off a spoon. And her medications we put in a little meatball to make sure those go down because she doesn't always eat everything out of the bowl right away, and we need to make I have to wait for delivery of my own products. Yeah. I could drive over to the warehouse, but it's a 20-minute drive each way. So if it was something I was desperate for, I would definitely go over. But so Shane is a little hard to feed. Thoughts on telmisartan versus benazepril for proteinuria? It's newly recommended. Yeah, I have never fed it. It's a blood pressure medication. So I never used the telmisartan in my practice. Okay, so we have 4 dogs. 2 of which, Stuart and Shayna, both have mitral valve disease. Stewie is a stage D, which is about as bad as they can get, and Shayna is a stage C. Shayna also has serious scoliosis, SM, syringomyelia, and CM, caudal occipital malformation syndrome. George and Gabby, actually all 4 of them have SM and CM. Shayna has resistant urinary tract infection, and cannot take antibiotics. When she gets any antibiotics at all, she becomes paralyzed and cannot move. It's very weird side effect, but that's what happens to her. So she cannot take antibiotics. So we've been playing with her urinary tract problems for a couple of years, and we just started something new from Adored Beast that I'll share and seems to be really helpful. And we just changed our probiotic around, and that also seems to be really helping with stool issues. Shayna in particular is prone to soft stools and GI issues. Stuart also struggles a little bit with that because of the medications that they have to take for their heart. So I'm just going to start. We have one basket that is the twice a day basket and another basket that's the once a day basket. Shayna and Stewie get the Kin and Kind Healthy Hip and Joint, which basically is a dry golden paste. It's got turmeric, black pepper, coconut. Let me find the ingredients here. Yep, that's it. Coconut, turmeric, and black pepper. It's all organic. It's used. They advertise it as a hip and joint product for arthritis. The reason I like it, yes, we've got arthritis with Shayna, so it's good for that. But the turmeric is also a really good chi tonic, so good for their heart health as well. So those guys get that one. Those 2 also get the Healthy Immunity. This used to be the Raw Berry Boost. This is coconut, cranberry, and blueberry. It's got dandelion. Oh, they changed it. Dandelion root, sunflower seed, flaxseed. The dandelion is really good. So this used to be advertised more as a urinary product, which is what I am using it for. But it's a really good antioxidant with the berries in there. And the dandelion is actually a really good addition because that promotes urination, and that's going to help lower blood pressure, which these guys need. Okay, we use the Dr. Harvey's Solaris. So in the morning they get the sunrise, and then in the evening they get the sunset. I love this because it has tons of healthy herbs in it, but it also, between the two, it's got 8 different mushrooms in it, and I really like those mushrooms for cancer prevention. Really good for GI health as well. Okay, cocoa therapy coconut chips. I'm using these mostly for Shayna and Stewie to help firm up their stools. But once a day I give the other two some coconut chips just because they like them and they're really healthy source of fiber for them. All right, this is a real medication. This is Lasix or furosemide. This particular brand is called Dysal. Shayna gets that twice a day as a diuretic for her heart disease. Stewart's heart disease is worse, so he gets torsemide as a liquid, and we measure that out with a little syringe. That's a much stronger diuretic that he needs because he's in stage D failure. Let me get everything back in here. Miss Shayna, because her arthritis is so severe and she cannot walk without help from medications, she actually does get Vetprofen. It is a non-steroidal anti-inflammatory, and I hate to admit that I use it because people will yell at me for that. But I need to keep the dog moving at age 15. She gets a half dose once a day, and that half dose once a day is Judy about the mast cell tumors. I have a blog on that and what we use to treat that, so please look for the blog on drjudymorgan.com. So Shayna gets a half dose of Vetprofen. That's enough to keep her moving. So she gets a half dose once a day. So we could up her dose a lot if we need to, but that's enough to keep her moving, and we get no side effects with using it at a very low dose. This is the Pimabendin or Vetmedin for Stewart. And this is the one for Shayna. They're on different doses. Stewart gets a higher dose than Shayna. They both also get sildenafil, also known as Viagra, and that is for pulmonary hypertension, which is secondary to their heart disease. Interestingly, Stewie is on a lower dose than Shayna, and he weighs more. So, Shayna, with her urinary leakage, takes an herb called swaquanwan. Really helps to keep her from leaking so much. Everybody gets CBD oil. The one we're using at the moment is the source, but Brandon on Naturally Healthy Hemp has a few different brands. We've used some of the others as well. I like the CBD Dog Health a lot. I haven't tried the new one that he just started. The CBD Dog Health has a stronger smell. Shayna didn't like it, and she refused to eat her food with it in it. So they all get the CBD for their SMCM. PEA, this was a life changer for Shayna. This is a fairly new product on the website. Had it maybe 6 or 8 months, but for the arthritis, the bladder inflammation, the SM, the CM, this stuff is amazing. All of our dogs are taking this, and we open the capsules and sprinkle them in their food. They get one twice a day. It's better absorbed when it's fed with some fats. Okay, trying to put things back in. All right, so for Shayna, we just started the Adored Beast urinary protocol. This is the easy peasy. She gets 4 sprays of this twice a day, and this is a homeopathic and seems to be helping. She seems a lot better since we started their protocol. So the other half of that is the Easy Peasy 2, which has cranberry, D-mannose, N-acetylglucosamine, marshmallow, uva ursi, nettle leaf, and a multi-strain probiotic, and larch arabinogalactin, which is a prebiotic. So this seems to be helping a lot for her. She also gets the colostrum to try to help with her immune system and fight off this infection as best we can, and also to try to help build a little bit more muscle for her because she's getting pretty weak in the muscles. This is the new probiotic. I don't like their bottle. It's kind of drippy. Don't shake it because it comes right out the top. The Sym-Biotic Canine, which is a soil-based probiotic and also has the chaga mushroom in it. And this has made a huge difference for Shayna with stools. All right, everybody gets this month. This month, yeah, that's about how long it lasts. They're getting salmon oil from Iceland Pure. We rotate when this bottle's gone, then we will switch over to the anchovy sardine, and then the next one after that will be salmon. We just go back and forth. Well, my dog's adored beast to replace all this drugs we're giving. Our dogs would not be alive without these drugs, so y'all can yell at me all you want, but our dogs would not be alive without their heart medication, so they're going to continue to get them. And then we're supporting them with the other products to keep their liver and kidneys healthy. And by the way, their lab work is perfect, so I think we're doing a really good job to have dogs that are 14 and 15 with perfect lab work. D-Ribose powder, this is given to Stuart and Shayna. And D-Ribose is a sugar, but it's very good for energy, so very, very good for dogs with heart problems. I am missing the N-acetylcysteine, the NAC. Stuart takes that for his glue ear. He's deaf. He has PSOM. Which is also known as glue ear. It's a common cavalier problem. We saw it on MRI. So the NAC helps, it's a phlegm drainer basically, and helps an anti-inflammatory, so it kind of helps drain that phlegm. He can hear a little bit when he's on that. Everybody gets CoQ10 200 milligrams because of heart disease. The two English toys are getting it just because they're a breed that's also prone to that. Stuart is on spironolactone, half tablet for his heart, and enalapril once a day also for his, once a day for his heart. They all get vitamin D3 because most dogs with heart disease have low vitamin D3, even though they are on balanced diets. Again, balanced on paper, balanced according to the computer, but when I had them tested, they were all a little bit low, some lower than others. Senior dogs will tend to have low vitamin D, so everybody gets that once a day. And they only need like 3 drops, but it makes a huge difference. They are all on the Deer Velvet Senior formula, which has green lip mussel, deer antler velvet, chondroitin, and ginseng. The ginseng is for circulation and brain health. The green lip mussel and deer antler velvet are for heart health, but also mobility issues. We keep RX clay on hand when we get really sloppy stools. This is the sunset, which is the evening part of the Dr. Harvey supplement. UC2, this is the ultra collagen, which Shayna gets for... Would the NAC do anything for CSF and SM? I don't know. I haven't used it specifically for that, but Stewie has SM as well, so who knows. This is for arthritis, and again, made a big difference for Shayna. We also keep some Dr. Harvey's runs be done on hand for when we get sloppy stools. So that is what is in our baskets at the moment. This is subject to change at all times as we discover new products that we like or as the dogs develop new issues. And let me just say, it's so much easier feeding the cats because they're not on anything except a really good diet, and they don't have any issues other than Mittens having a little bit of weakness in his hind end because he blew out that ACL a while ago. Okay, is this post in text somewhere? Nope. Nope. And I've done this video before where I've gone through our supplements. About once a year I do it, and the supplements will be different as as the dogs change, as their needs change. But yeah, basically 3/4 of this is supplements and 1/4 is drugs, but the younger dogs, the 2 English toys that don't have heart disease, are not on any drugs. They are on supplements. Shayna and Stewie would not be alive without all of this, so this is what they get. So that's where we are. Cranberries, can they get it every meal year round? Oh yeah, our guys are on this cranberry supplement all the time, and there are cranberries in their food a lot of the times. I don't refrigerate any of these. Our house is not hot. It's pretty cool, so I'm not refrigerating anything at this point. Okay, what do I recommend for spondylosis? Everything that's in the natural arthritis treatment blog, because that's just a form of arthritis. Would anything here not be recommended for a pancreatic dog? The only thing I would be a little bit careful with is the omega-3 fish oil. I would probably use an encapsulated fish oil instead of the liquid, just because they seem to do a little bit better. Otherwise, all of this would be fine for them. Okay. The PEA, look it up on our website. It's a plant-based anti-inflammatory. Really phenomenal. And it has lots of uses. Gwen did a post on it, I think it's a blog, last week, maybe. And it was also sent out in the newsletter last week. So, okay. Everybody, let's see. Sunny had her annual acute pain episode. Suspected SM, did you say prednisone would be good to have on hand for breakthrough pain? How much DGP could she go up to with acute pain? DGP, you can only dose 1 tablet per 30 pounds, so follow, and it's once a day, so follow that dosing. Prednisone, I have some on hand somewhere. Our guys have not needed it in a couple of years. Especially with the addition of the PEA. Okay, I have got to get to the farm, get the animals fed. Lots going on. I think we're getting a septic system dug today. So that'll be moving forward. Yay! All right, everybody have a great day.